Hey everyone, hope you're doing well. Today, we're talking about a topic that's really important for so many of us: Social Security and Medicare benefits, including retirement, SSI, SSDI, survivors, and spousal benefits. These programs are crucial for our financial security, especially as we get older, and there have been some news and updates recently that we need to discuss. So, did you know that the latest report suggests that Social Security can only pay out full benefits for the next 11 years? After that, it's estimated to only cover about 83% of the benefits. That's pretty concerning, right? This is why it's so important to stay informed and understand what's happening with these programs and how it might impact us. Let's start with some background. Social Security and Medicare are two of the most significant social programs in the United States. Social Security provides financial assistance to retirees, disabled individuals, and survivors of deceased workers. Medicare, on the other hand, offers health insurance to people over 65 and some younger individuals with disabilities. Now, there's been a lot of political debate around these programs. Recently, former President Donald Trump released a platform that promises not to cut a single penny from Social Security or Medicare. Instead, he's pledging to maintain the current retirement age and keep these benefits intact. This is a significant promise, considering there have been talks from various political groups about potential cuts or changes to these programs to keep them solvent for the future. Trump's platform also includes plans to end inflation and make America affordable again. He believes that by addressing issues like illegal immigration and lifting restrictions on American energy production, the economy will improve and costs will come down. This, in turn, is supposed to help sustain programs like Social Security and Medicare without making cuts. But here's where it gets tricky. While the president can influence economic policy, the Federal Reserve has a significant role in controlling inflation. So, promises to end inflation aren't entirely within the president's control. It's important to understand that many factors contribute to inflation, including global events, supply chain issues, and more. You see, during a recent debate, Trump and President Joe Biden had a heated discussion about the economy. Trump claimed that Biden inherited a strong economy and that his policies have led to the current economic issues. On the other hand, Biden argued that making the wealthy pay their fair share in taxes is essential to strengthening Social Security. The Biden administration has accused Republican lawmakers of planning to cut Social Security and Medicare. However, Trump has been vocal about not cutting these programs, saying that they are promises to American citizens who have worked hard all their lives. So, what does all this mean for you? If you're nearing retirement or currently receiving benefits, it's crucial to stay informed about these discussions. Changes to Social Security and Medicare could significantly impact your financial planning and healthcare coverage. And next, let's talk about eligibility and how these programs work. For Social Security, most people need to have worked and paid Social Security taxes for at least 10 years to qualify for retirement benefits. The amount you receive is based on your average earnings over your working life. Medicare eligibility generally starts at age 65 or younger if you have certain disabilities. Another thing to consider is how these benefits are funded. Social Security is funded through payroll taxes under the Federal Insurance Contributions Act, FICA. Both employees and employers contribute 6.2% of wages, up to a certain limit. For Medicare, the payroll tax is 1.45% each from both employees and employers, with no income limit. Speaking of which, there have been discussions about increasing the income limit for payroll taxes to help sustain these programs. This means higher earners would pay more into Social Security and Medicare. This idea is part of the debate about ensuring the long-term viability of these benefits. Now, let's dive into what you can do to prepare for potential changes. It's always a good idea to have a diversified retirement plan. Relying solely on Social Security might not be enough, especially if future benefits are reduced. Consider other retirement savings options like 401ks, IRAs, and personal savings. What's more, staying healthy can help manage future medical costs. Medicare covers a lot, but not everything. Having a supplemental health plan or saving specifically for healthcare expenses can provide an extra layer of security. On top of that, be proactive about understanding your benefits. The Social Security Administration offers tools to help you estimate your future benefits based on different retirement ages and earning scenarios. Taking advantage of these resources can help you make informed decisions about when to retire and how to plan your finances. So then, let's wrap this up by focusing on staying informed and proactive. Changes to Social Security and Medicare can have a big impact, and it's essential to understand what's happening and how it might affect you. Keep an eye on political discussions and proposals, and consider how different scenarios could influence your retirement planning. And finally, remember that while political promises are made, they don't always result in immediate changes. Policy changes can take time, and there are often many steps involved before any new measures are implemented. So, stay patient, stay informed, and keep planning for your future. Alright, that's all for today. Remember, your financial security is important, and staying informed is one of the best ways to protect it. Thanks for tuning in, and take care.